got, got our information about today's program to everyone throughout the state. Now, information that you see, this presentation is recorded and will be available on Facebook as well as YouTube. And if you're trying to very hurriedly get that information, don't worry. Today, at the conclusion of today's program this afternoon, we'll be sending out an email to all participants, and we will have that information included on how you can have access to the recording, as well as some other information that is presented today. So do not worry about having to grab those websites or the scans, QRs. We will have those for you coming through your email this afternoon. Okay, we're gonna stop the share, and I'm going to introduce Christy Stambaugh, and she's going to kick off our event today. Christy?
Hello, everyone. Hey, in case you wondered, we have more than 181 people joining us via Zoom today. And it's thanks to so many people that we're able to do this, and that we totally look forward to our October 21st, 2021 live in person, hopefully, Grandparents as Parents Conference. This would have been our 18th year back in 2020. So we're still calling this our 18th year for GAP. And today we're so thankful that Norma Hatfield is going to be presenting with us. It's thanks to the collaboration with the Fayette County Extension Office and Diana, who's hosting, and her staff, who are truly amazing, that you've been dealing with all along. And then we have amazing other members of our committee, some of whom might be joining us. And then our sponsors, and these sponsors came on board for our event that should have been last year in March, and because we all know why that didn't happen. But we had gold sponsors with Aetna and United Healthcare, Anthem, the Fayette County Bar Association, WellCare, Passport Health, Humana, and then our longtime sponsors with Friends with Children from the Bluegrass Regional Network and the Community Collaboration for Children. So it's thanks to them that we're able to, today's event is free. And then in October, when we offer our in-person one, again, hopefully, the cost to the grandparent is just $10. For professionals, it'll be $50, but that includes continuing education units for social workers and family resource specialists. And again, we're just so thankful that you all have joined us today. So let me turn it over to Mary Jo, who actually got this whole Grandparents as Parents Conference started 18 years ago when she was a mere 20-year-old person.
Good afternoon. I'm so excited that so many people are able to join us today. We weren't sure how this would go over, so we're thrilled that we have such a large number of people joining us, and we're especially excited to have Norma as our speaker. So I'll introduce her and let her get started. So Norma Hatfield's a grandmother and a child advocate. She is raising 2 grandchildren in Elizabethtown, Kentucky. And as a result of personal experience with the family court system, she's dedicated time and effort towards finding state funding to benefit relatives and fictive kin, caregivers, and the children they care for. Her persistent work with state legislators has created dialogue and policy modifications and continues to evolve. Norma is the president of the Kinship Families Coalition of Kentucky, a Grand Voices Network member. She is the recipient of the Kentucky Youth Advocates Courage for Kids, Champion for Children, and Kentucky Regional Planning Agency Outstanding Advocate Awards. Norma connects to a vast audience through her Support Kinship Care in Kentucky Facebook page and her work with the Kinship Families Coalition of Kentucky. We're just thrilled to have you join us today, Norma. think you're muted, Norma.
Of course, that's usually how it works. Thank you so much. I'm happy to be here. And I've got quite a few slides that I've got to get through. I hope I don't talk too fast. So if I do, just put something in the chat box if you need things to be clarified. We are going to talk about kinship care and a little bit of history there, what's going on. We're going to talk about being an advocate, and then also I've got a little section about taking care of you as a caregiver. So let's go ahead and go to the first slide. So really, you all just got a great introduction. I am president of the Kinship Families Coalition of Kentucky. First and foremost, I am a grandmother who's raising 2 grandkids in Hardin County, and I am a concerned citizen on behalf of so many caregivers, not only in Kentucky, but across the nation. There's so much more that needs to be done so that we can take care of our kids. And then I am a Grand Voice Network member with Generations United. And I have to say that I have a typo on there. I hate autocorrect, but Grand needs to be capitalized. We'll fix that when we send the slides out. But it's also, Generations United is also a fantastic organization that I get to be a part of. So let's get started. I'm going to tell you a little bit about my story throughout this presentation. We're going to talk about definitions as far as kinship care. You would be surprised how you can have 2 people in the room and talk about, I need my kinship support, and in their mind it's one thing, and to another person it's another. So I think it's always good to kind of have a foundation as far as the different types of kinship supports that's out there, kinship care. We're going to talk about advocacy, as I mentioned a moment ago, and care for the caregiver. So let's go to the next slide, please. So here is a picture. It kind of explains a little bit more about me as a kinship caregiver. Right after I got my granddaughter and she went back to school, they did an icebreaker, which I thought was, to me, this is probably one of my most precious possessions that I will have for my whole life. My granddaughter Kayla was 5. Actually, I think she had just turned 6 at this point. And the teacher said, all right, here's a piece of paper. We want you to draw a picture of yourself, and we want you to write your name, and we want to tell the rest of the class something about you. What's special about you? What's unique? And what she put on this particular project was, my name is Kayla Evelyn Dawn Hatfield, and I am special because I love school math. And another reason is my grandmother takes good care of me. And that is the case for thousands and thousands of other kids that are out there that are living with grandparents and other relatives. We do our best. We do everything we can despite some of the really challenging and tough circumstances, but we try to take care of our kids. And there are so many others out there that are doing that. We have three main groups of kinship care. There's informal. These are children that are living with relatives and they've been informally arranged. Their DCBS is not involved or anything like that. An example of this would be, let's say a biological parent had to go to jail and they call their mom or their dad and they say, hey, can you take care of the kids while I'm gone? That's an informal arrangement. Nobody else is involved in that. Those numbers are really, really hard to capture. There are estimates, but I think there's probably even more out there. There's also kinship care and fictive kin. These are children who are placed with relatives or fictive kin, which are close family friends. Those are the school teachers or coaches or neighbors or somebody that just steps up that has a relationship with that child in some way. That's a fictive kin. And these relatives are there. DCBS is involved, but they step in and they want to help these kids. And then there's the new one over the last couple of years, which is relative foster care. These are children that are placed with relatives or fictive kin, and you can become certified as a foster parent. And the formal custody is maintained by DCBS. Now, one of the things that I want to clarify, I'll probably bring it up later because I think a lot of people don't understand it. And that is that when you think, okay, I'm a grandmother and I've got my grandkids and they're officially fostered by me, that status ends at permanency, placement, or when that case is closed, which typically it's the same, but not always. And then you have to go sort out from there how you're going to get some other support services and things. And I can't tell you how many caregivers I've talked to that thought, okay, I've got the resources that I need right now, but they didn't know that they were going to end and they didn't have an opportunity to plan. So I just think that's important for folks to understand. I'm excited about the fact that we have this option now for some caregivers, but it's long term, we got to do more. We got to do more to support the kids. Kentucky has the highest rate of child abuse and neglect in the nation again. And that's a shame. I don't know why that is. I know that we have to do a lot more. I think that as a Commonwealth, we have to start thinking outside of the box a little more to figure out how to do this. I think we need to look at more preventative measures so that we can get these numbers down so that kids aren't going through a lot of this. We are now ranked number 6 for the number of children that are in care of grandparents. We used to be number 1. Approximately 77,000 children are living with relatives and fictive kin, formally and informally, from what we know, even though I think those numbers are going to go a little higher. And 63,000 children are living with grandparents. Nationwide, 2.65 million children are living with a relative or a close family friend that's not a biological parent in the home. These numbers are huge. They're fairly new. I think when we look at the 77,000, some people could say, hey, we went from approximately 96,000 to 100,000 last year to 77,000. But I think there's a lot of other things that are behind those scenes to why those numbers are a little bit lower. I put the sources for a lot of this data on the slide that you'll get later. But when I went back and looked at that, because I did think, hey, how did we go from almost 100,000 to 77,000? Some of the data capture on there was that the parent's not present, but the child's not fostered. So in the past, I'm not sure that we had looked at that, but I think that's a good thing in a lot of ways, because if we're giving foster care options to more caregivers, especially those grandparents and aunts and uncles that need it, then that would explain why these numbers go down. Holistically, though, we have to be aware that still we're number 1 in child abuse and neglect. These kids are still being removed from their homes, and we can't just let one particular number say, hey, we're doing much better. 2.65 million children is a lot of kids, and it's really too many. We want to see these numbers go down so that our kids are doing better. Let's go to the next slide. I love this graphic. It comes from Generations United, and it gives you a more holistic picture as we're looking at things. 30.5% of children whose grandparents are responsible for them have no parent in the home are living in poverty. 30.5% across the United States. That's pretty sad. We know for a fact that children are going to do better with somebody that they know. It's just less traumatic, less stressful for a child, even though we have fantastic foster families out there and we desperately need more. If it's at all possible, we want to have the kids stay with somebody, a family member, to keep their identity, to just mentally it's much better. I will tell you that my kiddos, and I'll go into it a little bit more later, but my kiddos went straight to foster care, and the system didn't work the way it was supposed to. And it's been 6 years since that happened. And while the family was wonderful, they don't like to talk about it. It was traumatic for them. My granddaughter was 5 at the time, and it was a very scary experience. And if we can avoid that, we want to definitely do that. Let's go ahead and go to the next slide. So we've come a long ways. While we've looked at, now there's the options to have foster pay for caregivers, so that the kids can have the supportive elements that they need. I think that's really important. But it starts with the Kinship Care program that was out there till 2013. I'm going to talk a little bit about that. I'm going to talk about what I call the families that are caught in the gap. And I just wanted to clarify that while they're caught in that gap, they got very little support. Some have none, just because of the way the financial elements are, the lines are kind of drawn. It sometimes just, to me, it doesn't make sense. And let me also say that my opinions are not of any particular organization. It's just my perspective on how things are. But I think we have to do a lot more, and we can't forget these folks that are in the gap as we look at new programs. There's DO versus GLSEN in 2017, which first really provided an opportunity for foster pay. And then later, after Family First, Kentucky really jumped in there and set up their DCBS service array. And then I'm going to talk a little bit more about a couple of other programs and more gaps. So the previous Kentucky Kinship Care program, and I kind of wanted to clarify that because there's, as you just saw a moment ago, there's a lot of different aspects that people call kinship when they're talking about the services that they need. But this particular program, it ended in 2013, and it provided $300 a month per child for a kinship caregiver who took in children where DCBS was involved. And I will tell you, we have people that are still in the program today because when they ended the program, they grandfathered all the folks that were in. And so they have to get recertified every year to make sure that they still qualify and that they still have the kids in their care. But every single caregiver that I talk to says, I don't know what I would do without that support, without those kinship dollars. And I think that's really important because if we're going to place kids, abused, neglected, traumatized kids with someone, there should not be a bias, just my personal opinion, there should not be a bias on whether they're in traditional foster care or they're with a relative. Those children need services no matter where they go. That's the bottom line. We have to take care of those kids and make sure that they have what they need. There is a recertification issue. I will tell you, I get people reaching out to me a couple of times every year saying that they just lost their kinship from this $300 assistance because of the recertification program. So let me tell you very briefly about that in case you talk to someone who is in this situation. There is a phone, when you start coming up on your year, there is a phone call that you have where you do discussion with DCBS, and they kind of go through to see, hey, everything is still as it seems. You're going to qualify again this next year. And then they put in the mail a package for you to recertify. You're going to have some other folks witness, usually people use their neighbors, that the kids are with you, and there's a series of things that they're going to ask you about. And one of the things also, and I will tell you, a couple of people, they make the mistake of letting the biological parents come back and live with them. That is going to cost you this program. So you want to make sure you understand all the guidelines that are there for the program to make sure you stay in it. But after you do the phone interview, and they send those papers, the problem is that there is a 10-day window from that phone call to get the papers back. It's 10 calendar days. So I had an aunt, I believe she lived in Fayette County a couple of years ago, and she explained this whole thing to me. And she said, I didn't get it in the mail in time. So I went back and I looked, and what happened was there was Christmas, there was New Year's. The mail doesn't run on those days, and those were during the week. Then she also had Saturday, Sunday, and a Saturday, Sunday. So she just lost 6 days. Of course, she's not going to get it. The other part of it is that we put in the ombudsman complaint is that let's say that the person at DCBS, and I don't know what their processes are, so I just kind of use this assumption when we wrote it up. But let's just say they make that phone call on a Thursday night, and then they put the packet on the desk, and then they call in sick the next day. It sits over the weekend. There's days that are lost. Or we don't know how long it takes within DCBS's mailroom to the postal service. And then depending on where you are in the state, it could take a couple of days on either side. 10 days is not enough. So one of the things that I tell people is when you get that paperwork, immediately ask for an extension. If something is delayed and you know from the time of that phone call, you need to be requesting an extension. You haven't gotten it yet. You can ask for 30 days. And you want to do that, and you also want to document it, and you want to get it in writing. But if you find that you're in that type of situation, you can always reach out to me. You can reach out to the coalition. There's a lot of organizations around, but I just wanted to highlight this one because I just had a talk this last month with another grandmother, and this is what happened. And we have an ombudsman complaint that's sitting out there right now because of that 10-day window. So after April 2013, the program ended. Let's go to the next slide, please. The gap. So from 2013 to 2017, there was no kinship care program. There's a few things that you could get. You could get Ktap potentially, and then there are some downfalls there as far as keeping Ktap, and I'll go into that. You know, there's other services which we'll go into, but a lot of families, what I found is that the way they look at the income level, they don't really qualify for it, but they're desperate. They're absolutely desperate for additional assistance for these kids. And, you know, for folks that don't know this, they don't get the opportunity to plan ahead of time, to talk to their work if they work, to make sure that, you know, they're ready to take the kids in and get them settled and maybe relook schedules and, you know, so they can drop them off at school or daycare. They don't have that. They don't have the opportunity to make sure there's a bedroom set up with nice things and all that's going to be there. And if it's a baby, to have the crib and to have the car seat, stuff like that. It's the phone call or the ring of the doorbell. That's your notice, pretty much. And so whatever financial circumstance that they were in before, just became a little bit worse in most cases. I'm going to talk to you about some advocacy that I did and a petition that I did for Kinship to try to bring back the old program. And in there, I want to tell you that I had thousands of stories of caregivers from around the state that talked about, I'm a single widowed grandmother or great grandmother or great aunt, and I was in a small bedroom apartment, and I had a very small car, and I got 4 kids now. Something's got to change. I've got to look at things a little bit differently. I need more resources for these kids. These families from 2013 to 2017 are caught in the gap. And while we're doing really great programs now, looking at the service array, the DCBS service array, to look at foster support and things like that, we are not addressing the thousands and thousands of families here. And I just wanted to bring that up because I don't want them forgotten. I know their personal stories, and I've heard their pleas for help. So as we look at becoming an advocate down the road and looking for more change, we need to be looking at how can we address the families that are still in need before a new program comes on board. What can we do for them? So let's go to the next slide. So it was really exciting. In October of 2017, there was a federal court ruling, U.S. Sixth Circuit Court of Appeals ruled that Kentucky must pay relatives who serve just like foster parents. There were some conditions. You had to have a case with DCBS, and you had to have a home study, which most of the time DCBS is not just going to leave a child with anybody. They're going to do a look at the home. They're going to do some background checks. They're going to try to place with a relative. So this was really exciting, and the headlines everywhere said that relatives now get foster pay. Not quite. Some relatives did, but not everybody. There was one piece on the criteria that Kentucky used, specifically just what I saw in the families that I worked with. And I'm just going to interpret it. It had to be that a child had to have previously been in foster care. Well, we want to prevent that. And so there were quite a few families out there that then were not allowed to get the foster pay under DO versus GLSEN. And I will tell you, there's been a couple of class action suits that have been challenging all of this. It's a lot of opinions out there. It's complicated, but it helps some families, and they're very grateful. It just didn't help all that I think people thought should get the help. And the bottom line is these families, they need help. They're taking the kids, they need the resources to do that. So let's go to the next slide. And then in April 1st, 2019, this one is really, really exciting. And I want to tell you that Kentucky was one of the first states to really jump in and take this on. I mean, there were some others, but Kentucky was definitely right up there. And I'm just so proud of the fact that the DCBS did that, the Cabinet for Health and Family Services, because they really did step forward to help more families. So on April 1st, 2019, for any cases, really more new cases, I'm going to say, within that window of time, you were then given as a caregiver an option. If a child was being placed with you through DCBS, and you met the criteria, the children were abused and neglected, you got an opportunity to become a foster parent, foster caregiver, relative caregiver, and that has been huge. But I will tell you that some of the challenges with that are, first and foremost, that I think we probably still could do a better job as far as communicating the options that are out there. Because caregivers, I know a couple of them, they said they got the form. Of course, they're in this mode of, I call it, fight or flight. This grandmother just found out that here's the caseworker, and she's contacting the grandmother, and she said, well, your grandson's being removed. There were drugs in the home, and you can take custody of him, or DCBS will take custody. And the first thing out of her mouth is, of course I'll take him. So she signed the form saying that she would take temporary custody. What she didn't realize in the form is that you can get foster pay, the child's in DCBS custody, but you can take care of the child and still receive the foster pay option. And that gets confusing in those moments with everything that's going on. And so I try as much as I can to let people know about that, to ask all the questions of that form, to make sure you really understand what that means. I know that DCBS is looking at, how better to communicate some of these things so that the right services go to the right people. And the other thing is that you don't immediately get the foster pay. You might get $6 per diem until you've been approved, but then you get the back pay from the time that you begin that process. And I think you have to sign a contract. It ends, though, when a child is, when permanency happens, or that case is closed. And that part, again, is a little bit tough for a lot of families, because they're using those resources, and they don't always think about, okay, in 6 months from now, 10 months from now, I've got to find some other resources somewhere. Or you can just have temporary custody and, go through the process, which is what a lot of the families have from 2013 to 2017. And whatever you might qualify for, such as Ktap, you try to go after those services. So Ktap is the Kentucky Transitional Assistance Program. And very quickly, you can kind of see on the slide, number of children is 1, and you get $186 a month. But if you have 2 children, it's $225. You get to 4, then you get to $328. Think about the old Kinship Care program where it was $300 a month per child. So this is something, it does help some families, but it's not available for fictive kin. And the other thing that I want to see changed, and I'm going to be definitely talking to a lot of legislators in this next year, is the child support aspect. So I've had some families come to me and say, well, I did have Ktap, but then the biological parents quit paying child support, because you have to sign a form to get Ktap saying that you understand that they're going to be going after child support, and that has to be there for the biological parents. And so the caregiver, let's say the parents are doing really well, and then all of a sudden something happens, and so they quit paying child support. So I've had some families just let it go. These great grandparents that are living on Social Security and desperately need this additional support for these kids, they let it go. Why do they let it go? Because they can't afford an attorney to go after the child support. I mean, think about this. One child is $186 a month. That's less than $2,400 a year. Some attorneys I've seen retainers from $1,500 to $5,000. It's more a lot of times than what they get in a year for the Ktap. So they can't. And the other piece of it is the emotional aspect. They don't want to further get the biological parents in trouble somehow and go back to court, and then that could mess them up somehow. Foster parents don't have to deal with that. That's all taken care of through the state. They have services set up to kind of go after that. Why aren't we, at least for the families that need this the most, who don't receive very much, why aren't they also making this service more available? Why isn't the system making this service more available for them? They're needy. They need this for the kids. Don't put that on their plate. Okay, let's go to the next slide. The relative placement benefit. This is currently a one-time monetary benefit that is a caregiver can give. You get $350 for a child, and then it kind of goes up from there. It's capped at 6 kids. It's a one time in a lifetime for a child. So think about this. You have a baby, and that baby, let's just say 3 months old, and you get them. And so you use the money to go towards a crib and a car seat and diapers and clothes and things like that. Let's say that the parents do really well, and eventually the kids go back to their biological parents. A couple years later, something happens and the child comes back. Now the child's older, so they might not necessarily need diapers and car seats and cribs and things like that. They need different size clothes and all of the necessities that are out there. You don't get the one-time benefit. You don't get that assistance again to buy those things that you need. And let's be real. These kids are going to need that. The caregiver is going to need that. And the other part of this bill is it's capped at 6 kids. Well, if you've got 8 kids, they all need clothes. They all need their bedding. They all need hygiene items. Each one individually has their own needs. So what I'm excited about, that House Bill 492, we have several representatives out there, Representative Mead, and I've got the list. It's Goforth, Regina Huff, DJ Johnson, Massey, Moser, Wesley, and Westrom. They all have sponsored this bill, that is, it's got a lot of things that are in there, but specifically as far as the relative placement benefit, it includes fictive kin now, which is great. And it modifies the once in a lifetime so that it's when a child is placed. And it also, because of that, removes the cap of 6. That gives basic necessities to a child when you have no planning at all. It is huge. When I got my kids, I had 2. I had to go buy everything. And I will tell you that it was more than $350 a child, but this is huge for people to get them started when they don't have a lot of resources that are readily available. So I'm excited about this bill. I'm waiting to see how far it goes. We're pretty close right now, but this one I think is definitely going to start making more services and supports to more caregivers in the future. Let's go to the next slide. Okay, so my story. Sometimes it's hard to talk about. It just is. And I've told my story many, many times. So in 2014, it was in the summer, I had made arrangements, my husband and I, that we were going to take my granddaughter, Kayla, who was 5 at the time, to Disney World for her very first trip. We were going to leave on a Friday morning. And I was going to pick her up on that Thursday before. And I made an appointment for her to get her nails done. And I'm going to take her out to lunch. We were going to do all these great things and just make it a really great long weekend. I was just so excited. Apparently, the night before, on that Wednesday night, there were 4 kids in the house. 2 were my grandkids. The youngest child, who was 17 months old, ingested meth from a spoon that was in the bathroom. You know how little kids just grab things and put it in their mouth. Apparently there was a spoon in the bathroom with meth. So what resulted is that the child had to go to Concierge Hospital, and the other children went to foster care in another county. My son, who is the biological father, was actually living with us at this particular time. We didn't get a phone call. So the system didn't work as well as maybe it could. So that happened on Wednesday night. Thursday morning, I go to pick up my granddaughters, and the neighbor tells me what happens. So I call my husband, I call my son, we go straight to the DCBS office. I knew nothing about this system, absolutely nothing. I didn't know any of my legislators. Shame on me for that. I didn't have a reason to know them, I guess, other than, you know, you want to be aware of what's going on around you and make sure you make smart choices when you vote. But I knew nothing. And so we go in, and I'm thinking, okay, this is going to be easy. We'll just tell them who we are. We'll show our ID, and we'll get her. We'll get Kayla back. And we were told, here's a phone number. We're going to call you. We are going to get information to do a background check and be in court on Monday morning. That's all we knew. So we didn't know if we should have an attorney. I didn't know, you know, get my house cleaned up, what do I need to do? What do I need to bring to court? I had absolutely no idea. All I knew is that for the next few days, my granddaughter was living somewhere else, and I couldn't even tell her that it's going to be okay and that I love her. So we go to court on that Monday, and that's when really about 18 months of being in the system kind of really kicked off and started. We didn't get the kids. The background check wasn't done, unfortunately. And things just kind of kept happening from there. So I'm desperate after court on that Monday. I'm desperate for information. I don't understand why this happened the way it did. I don't know what to expect next. I'm being told somewhere there's going to be a background check. I don't know who does it. at what level? What am I supposed to do to kind of move that along? I had, why can't I have a phone call? What are they going to do when they come look at my house? Because I did get told that eventually they would be doing that. What are they going to be looking for? I didn't want to have a failure on something and not hold the kids up for a couple more weeks. I just didn't know. And so the first thing that I did is I went to the Family Resource Center at the kids' school. Let me tell you right now, of course, this is all my personal opinion. Family Resource Center coordinators, I don't think their value is truly, truly appreciated to the people around the Commonwealth. They are absolutely amazing. And so this particular coordinator said, "Oh, okay. Here's what's going on. You want to call this lady at this particular support group here in Hardin County, and she'll kind of help you walk through some things." She also, the coordinator also, just said, "Well, when the kids do come to school, these are the things. Come see me. I'll help you fill them out. I can offer you some things here in the center." She was a godsend. She was a lifeline for me. I went to a support group, my very first one, and I was shocked. I'm all stressed. I have so much bottled up. I want my granddaughter back. I want to talk to anybody and everybody. And I sit there for a few minutes looking around the table because they sit and they eat breakfast. And I'm blown away. I thought my story was bad. There are so many other people in Hardin County, in Bullitt County, everywhere across the Commonwealth. And their stories are even more surprising and even more sad. So I started then getting information from the other folks that have been through what I've been through. I then, knew at least what was going to happen when they started, when they came into the house, what were they going to be looking for? I started visiting other support groups and started learning more and more and more. What I found is that there are, again, so many caregivers out there that had nothing. They were just struggling in silence. There is a bias. I have sat in forums that have had folks from, human services from other states. I'm telling you right now, there is at some level a bias against relative caregivers getting more services and support. We have to change that. It's getting better. You can see that with the DCBS service array, with foster options. There's more federal options that are coming down, legislation that's coming down. It's getting better. We're not there. And the other side of the coin is that you've got families out there that are afraid to ask for support because they don't want to be seen as, I just want money because I'm taking care of my family, but they really need it. And that's a shame. We've got to have more people speaking out, talking about what it is that their children need so that we make sure that they get what they want. So I decided, I went to Kinship Coalition of Kentucky Youth Advocates, started looking up stuff at Generations United, looked at what was locally within the support group. And I said, we need to get in Kentucky this Kinship program back for the families that need it, that $300 a month per child. We need that back. I will tell you that over 2 years, I wrote letters to anybody and everybody. And I was sometimes shooting in the dark as far as who might be able to help me and who wasn't. I will tell you that after I looked on the Kentucky Youth Advocate site about being an advocate, I found that my letters were way too long. My letters were way too emotional. They weren't really getting down to the point of what it is that I was asking for. So I started making my letters and my emails a lot better. As soon as I did that, I get a phone call from my local senator who happened to be Dennis Parrott. And he said, sure, I'll be happy to meet with you. So we met at a local diner with his daughters, and I brought a friend, and I brought all my data, statistics and stories and things like that. We sat down and we talked about it. And at the end of that, he said, you know what, Norma? He said, I'm going to take this. I'm going to go do a little more research and I'll get back to you. A couple of months later, I got a phone call and he said, I'm doing a pre-file bill to bring this program back. After 2 years, I finally figured out how it should work, that whatever I was asking for, I made it a lot clearer. I didn't give up. And there's a pre-filed bill coming. And the other thing he tells me, though, you know, because I'm thinking my job's done. Now it's his job. He said, well, you might want to see about building some momentum. I'm paraphrasing, but he said, you might want to see where you can kind of build some momentum. And so I thought, well, I'll do a petition. I offered to the coalition, Kinship Coalition. I said, hey, y'all got any place you want me to talk, reporters, anything like that? I will tell my story. I will tell them what I know. I did get an opportunity to do some of that. And I started that petition. I started out really slow. I didn't know what I was doing. I'll be honest with you. I had a cousin in Harrodsburg, and I had a cousin in Danville, and I had a family member in Lexington. I knew somebody in Corbin, and I started with the support group here in Hardin County. And I started out with paper petitions, and then I started on Facebook, and then slowly set up the Support Kinship Care in Kentucky site. And then the word started going out. Next thing you know, I've got 6,000 personal stories from around the state of Kentucky, or supporters that said, I'll sign your petition because I know something needs to happen. From that, as the bill started to started getting into session, I thought, okay, now what do I do? And so, first I thought, well, this representative's only going to want the letters from their particular area, and this one's only going to want their particular area. And I thought, wait a minute here. They need to see the big picture. What's happening in all the counties across the Commonwealth? They need to see the big picture. So what I did was I copied those 6,000 stories and signatures, and I went up and down the hallways in the annex, in the Senate hallways, and I delivered a full package to every single Senate representative. I offered to testify where I could. I will tell you, in the end, my granddaughter did get to give a copy to Governor Bevin, and it's Family Children's Advocacy Day that Kentucky Youth Advocates host every year. We made a point of going there, and we just happened to find him in the corner, and my granddaughter gave it to him, and she just made me tear up, because when she handed this big package, it was like a big phone book, she looked at him and she said, this is to keep kids out of foster care. And I don't think anybody could have said it better. Let's get the services for the family members that are taking care of these kids and keep these kids out of foster care. Let's make sure if a child is abused and neglected, no matter whether they're with a family member or they're with somebody else, such as a foster family, those kids need those services and they should receive them no matter what. So that's kind of how I became an advocate, how I am speaking to you today, kind of sharing a little bit of what I know, what's going on out there. As I see and hear more stories and I see issues, I try to work with different organizations that are out there so that we can try to get more change, because we are just not there yet. There's just so much more that we have to do to make sure that the kids get what they need. And I know I say that over and over and over, but that's what this is all about. Kinship caregivers are taking care of kids in need, vulnerable children. Those children need things to recover, to thrive, and we need to make sure that they get them. Let's go to the next slide. So I kind of talked a little bit about this already. This is from Kentucky Youth Advocates. You want to make your voice heard. Let me tell you, it matters. It absolutely matters. That bill that I told you about, it didn't make it through the first year. But over time, we got another bill in place and it did go through. It didn't, in the end, we didn't get to reinstitute the old $300 a month program. The money, I believe, was used more towards the families from DO versus GLSEN, but it still supported kinship families that are out there. And We had more buy-in because the bill passed, more of the legislature. I can't tell you how many senators and House representatives have told me, I've never really understood this before. And that's what I've found when you write your letters. If they don't understand something, they're not going to invest in it. So we have to be really good and clear about whatever it is that we're asking for. So you want to make that appointment, you want to write those emails, you want to write those letters, you want to look for where a legislator might be having a public hearing, you want to plan. You want to think about it. You want to do your homework. What do you want to give them? Do you want to give them some statistics in your county? If it's tied to your particular issue, you want to look at what's going on around the state or nationwide. Generations United, Kentucky Youth Advocates has a lot of that stuff. And that's things that I took with me when I saw Senator Parrott. You want to be kind and you want to be friendly and professional. You may be upset, and trust me, you may be upset. But they're not going to listen to you if you're not in a mode where, you know, they don't feel threatened, first of all, but also, you know, it's they have to understand, and so having that connection is the best way to do that, even though you might feel emotional. And then always send an email or a thank you note, you know, giving their time, because they do have, you know, look at your county and what your population is and whatever part of your district is, there's a lot of people asking for it. And so I'm always grateful that I did get their time, but that's just show that appreciation. You can go and look up, there's a link there, or you can go to the Kentucky Youth Advocates site. You can see who your legislator is. I had to do that. I will tell you that right now. I didn't know. And so for me, that's really important to know who your legislators are, so you can try to let them know what it is that you want to see, whether you're thankful something just happened and a bill passed, or something that needs to change. Bottom line though, I wrote letters 2 long years. Do not give up. If you really believe firmly in whatever that issue is, don't give up. You keep on until somebody listens. It's so important. I got this from AARP. Just very briefly, we've all been challenged by this pandemic, and it's hit a lot of people very, very hard. I can't tell you how many folks that I have talked to that especially grandparents that really had a tough time in the pandemic. Now, we're not good as caregivers taking care of ourselves anyway, but then you throw a pandemic in the middle of it, and it can really make things, you can feel like you're at a breaking point emotionally and physically. In fact, I talked to a grandmother, it's been probably 6 months or more. She was about 74 years old. And she told me, she said, I've got 4 or 5 kids and some of them were teenagers. She was living in a tiny apartment, so there was no yard. She was terrified about the virus because if something happened to her, what happens to the kids? So they stayed in more. She was in tears. She said, I just need somebody that I can talk to, somebody I can connect with. She didn't know how to do Zoom and all of those things at the particular time. And she didn't know what to do for herself because her whole focus was on these kids. So we all can understand that. And then you've got the stressors of income and jobs and the loss of businesses, things like that. That just makes it even worse. So I saw this home mini recharge through AARP, and it may not fit you exactly, but I think it's great to kind of, you know, think about some things that you can do, or you can recommend for somebody who might need it. You know, breathing exercises, paint by number kits. For us, the kiddos, we did puzzles. It drove me crazy some days, but we would put a puzzle out on the dining room table, and at different times of the day, we were all walking by putting pieces in there, and that was a stress release. Kind of go somewhere and think about something totally different for a few minutes. You know, prayer, meditation, yoga, needlepoint. My granddaughter, my oldest granddaughter, we had some old material. She even took some old clothes and cut it up. because we weren't going out a whole lot either. And she got on YouTube and learned how to make scrunchies. And so she did that. And for her, that was cathartic. Dancing, you know, I just wanted to kind of share this with you because I thought it just kind of take that few minutes for yourself wherever you can. I will also say, find a support group, connect with somebody you can make those phone calls, and find somebody else that understands. It's so, so important. This handbook came out last year. I think it's September of 2020. And this is a free resource that was mentioned earlier. You can also go to kinshipky.org. You can download it. You can contact the Kinship Families Coalition of Kentucky. If you can't download it and you want a hard copy, you can email us and let us know, and we'll get a copy to you. It goes into more detail of a lot more than what I've talked about here. It's got all different kinds of services. It's got a listing of clothes closets and some food pantries, and it's just a great starting point. It's something that I wish that I had had that weekend that my kids were gone, because it goes into you know, the background checks and home assessments. What's a CASA? I'm going to have another person coming besides a social worker. It talks about court hearings, kind of what to expect, definitions. I find this a resource that every caregiver, when they're put in this situation, needs to have. And it's free. These are listed in the handbook as well, along with a lot more stuff, but I just briefly wanted to mention that you can get Ktap. I do want to say, when you apply for Ktap, you can apply using your income, but if the child doesn't have an income, you can also do child only and apply with the child's income. A lot of people make that mistake and don't know that. And then there's SNAP, there's Kinship, there's a hotline. If you go to Kentucky Faces, they have, it's a great site. It's got information for kinship families. It's got foster families. It's got, you know, basic, how do we support you? But in there, if you want to know if you can qualify for a service or you have a question, you can email relative.supports@ky.gov, give them a little bit of information about you and they'll get back to you, or you can call. But I do tell people most of the time, I like to have things in writing. So I usually do an email, but that is a great resource, and everybody's situation is different. So you can't assume that you won't qualify for something just because somebody next to you didn't qualify. Every situation's unique. I always say, go ask. If it's a no, get the no. But if it's a yes, hey, you've got what you needed. Here's some other contacts. Again, most of those are also in the handbook as well. The Ombudsman's Office. We've got Kentucky Community Action Agency. I've got local support groups in red. Find a local support group. The Kinship Coalition actually has a tab with a lot of the support groups that are out there. If you know a support group that's not on that listing, let us know as well. But this is so important to connect with other people that have gone through what you're going through, that can be there when, you know, they can't go into court with you that particular day, but they can be there for you afterwards. So you have somebody to talk with. It's a way to connect with, you know, I watch the kids one day, you watch the kids another day, you know, outside of a pandemic. It just, I can't say enough about local support groups. We need one in every single county in Kentucky. I also have my personal email, kinship.care for kinship.care.kentucky@gmail. Sorry about that. And I also have a Facebook site, Support Kinship Care in Kentucky. And when I know some things that are going on, I'll forward those from other support groups, or if I see something from DCBS or something going on with the legislators, whatever that might be, I try to share those out there. There's a new resource, the University of Kentucky KINS program, so you want to go check that out. They're doing some of those same things. They're sharing available services and support elements that you might want to know about. So And also there's the hotline we talked about, and then the Division of Family Support phone number. And I think that might be the last slide.
Yes, Norma, that is the last one. What an amazing 1 hour of information that you have provided our audience today. We can't thank you enough, but you're not finished yet. So we're going to look at some questions now that have come in. And let me just get started with those. So the first one is there any financial programs that I can apply for? And also, I have permanent custody of a great nephew who is 4. And do I need to do anything to make sure that his mother doesn't disturb his life that my husband and I have built for him?
Let's see. Some of that I'm probably not going to have all the right answers for, but I think, I don't know what kind of permanent custody, if it's shared permanent custody, if it's sole permanent custody, but, what I would do if you're not sure, and I don't know how long you've had custody, what I would recommend is go to that relative supports hotline. And I would let them know, if you have the case number, the name of your great nephew. The case number is one of the basic things, but usually I give them the name of the child, the date of birth, the case number, and your contact information, and ask them to go pull that up and see what you might qualify for. Look at Ktap, see if that's a particular option. I'm not sure, every situation is different. As far as the custody piece and the biological parents, I think it depends on I would probably start with what were the terms of the custody arrangement. Sometimes there are placements and the biological parent can only have supervised visits, and sometimes they can have unsupervised and share. It could be a whole gamut of things. So I'm afraid I can't really go into that one in depth, but maybe start with the hotline and then work from there.
Okay. Can people that take in a family member's child receive help if the child is from another state?
That's a tough one. Now, let me just quantify. I'm not DCBS. I'm not the expert in a lot of these areas. I can just tell you what I know, take it from that perspective. So I always tell people, always follow up by asking DCBS in your particular area. But from what I understand, that it doesn't, unfortunately, children don't always aren't covered if they come from another state. Well, I think that's something that needs to be addressed and looked at in the future. But I have talked to several family members that lived in, the child came from Kentucky and went to Tennessee. It was one scenario, but then the child comes from Tennessee to Kentucky and they were excluded from a lot of the services. That one needs to be relooked, but I'm not sure at this moment.
We had custody of 4 grandbabies and adopted 2. When that became final, we lost the Ktap for the other 2 children.
Yeah. There's so many things that need to change. I don't know all the details on that, but what I would do is I would go back to that relative supports help desk and just ask again and ask why and get more information. They have to have some particular rationale. And I think if you ask for that, at least from there, is this something that maybe I need to do an ombudsman complaint for, or no, okay, now it's very clear and I understand. I just don't have enough detail there to answer that.
Okay. We have a comment from Amanda. She is a Frisky coordinator and she hosts community-wide support groups in her county. What tips of advice would you give to coordinators to help caregivers?
First of all, I love every single Frisky out there. I just feel you're underappreciated, underpaid. overworked. I have so much respect for every single one of you out there, everything you do. I volunteered at the center where the kids are. I know, I've seen it. You don't get enough recognition. I think one of the things that I would tell them first is get that handbook, ask for some copies, see if we can get you some copies or print some copies out, have those on hand. Reading through those, if you don't really understand how the system works for kinship families, that will explain a lot of it right there and where you can point the families to. The other thing you can do is the Kinship Families Coalition of Kentucky can also provide a presentation. If you request it, they can come to the school, or if you have a support group, we can connect you with some resources there as well.
And I might add, you will be receiving information. GAP of Kentucky, our own office, Fayette County Extension, helped with that handbook. And so it is on our website, it's downloadable, and it's even divided into chapters by sections. So you'll get that information later on in your email today. And we certainly want you to utilize that, because it is a great work, and Norma put a lot of work into that as well. Where do I get requirements or guidelines to the new array?
Requirements or guidelines. So I would start with Kentucky Faces. That's what I would do. Go take a look, kind of just, browse through the links and see what's out there. I think there's some videos you want to watch as well. And that's how I would start getting acclimated. I think between that and then looking at the handbook, it kind of helps put a little bit more of the story together. That's my starting point. And I will tell you, that's what I did. As soon as it came out, I went, okay, what do they have to say? And I learned some things.
Okay. We also had the question, and if you didn't hear us at the beginning of the session, we will be sharing this PowerPoint, these slides with you in the email that is a follow-up to today's program. So you will get the slides, which did have a lot of good information and contacts for you to utilize. Are there any other questions that someone wants to put in the Q&A? I do have a comment here. The DCBS Ombudsman Office is happy to answer all questions from attendees. So keep that in mind. They cover family support programs as well as protection and permanency programs. So that's DCBS.
They have a change in their phone number. Diane, if you zip through some of those chats, and then we have a great listener who has been able to answer some of those questions about finances and what a family might be qualifying for, and that's Ktap, Kinship Care. And if you could follow up on that, that'd be great, Diana.
Yeah, and the phone number is, and those of you, if you do hit the chat box, you can look at a lot of good information that is in that chat box that were not necessarily questions, but are comments. And the DCBS's phone number is 855-306-8959. And I'll repeat that, 855-306-8959. And then there's the family support program number, and which is the Ombudsman Office, and then that is an 800 number, 1-800-372-2973. 1-800-372-2973. And that is the Ombudsman Office from DCBS. I'm going to look through here and see if there's anything in chat that we've missed. But again, there's some good information there if you want to just take some time and look at the chat box as well. And I would encourage all of you to go to the chat box and show your appreciation to Norma today for the wonderful information and presentation that she has provided us. So take some time to do that right now and give her a shout out for just being willing to help us embark on a new and different way to distribute information that is so well needed. And we didn't want to wait to fall. Norma was a featured speaker for our conference, which would have taken place a year ago, and now will be October the 21st. But I'm sure we're going to have a role for her in that conference. So stay tuned, and you'll be able to meet her in person, and she'll be able to share with us once again. But I'm looking at the chat box. It is flowing, Norma, with all kinds of wonderful accolades for you, and we're just so thrilled that this went off so well. And I'm looking, and I don't see any more questions, but I do want to reiterate that every attendee today on the webinar, we have your email address, so we are going to be sending you welcome information, and we hope that you will stay in contact with, again, all the suggestions for support that Norma provided. I do want to mention extension offices, cooperative extension offices. Many of these FCS agents, Family and Consumer Sciences, they coordinate support groups as well. So be sure and contact your local extension office to see if there is one available in your county as well. Is there anything last closing? You have a chance to read through all of these, and they're just it's very heartwarming. All the kudos that you're getting at this point, they're just rolling in. Is there anything else that you would like to leave in last remarks, or anything from Christy or Mary Jo that you would like to share with our audience?
Well, I just want to thank you for the opportunity. I will talk kinship care to anybody, anywhere, pretty much anytime. So I appreciate it. It's a little harder virtually because I like to kind of connect with people, but more in person. But we'll get there. And I'm just tickled that you all did this event, and that I got to be the first one to try it out. I just thank you so much for the opportunity.
There's a comment in the chat box that says, wanted to let you know that we have been instructed to extend the kinship cases out 30 days. So
that's great, especially with the pandemic.
Yeah.
I saw a question asking about the conference location. Our conference is held in Lexington. It is the Bluegrass Regional Conference. Our planning group is from this area of Lexington, but of course, anyone and everyone is welcome from any part of the state if you'll travel here to come. And it will probably be at the Clarion Hotel in Lexington, and information will be ready. I would say look for that by the end of the summer. Hopefully we'll have that ready to go out and for registration. So.
Absolutely. And we do, and Mary Jo, it's amazing how many counties do participate. So it is more of a statewide conference than even the Central Kentucky area. So we do want you to try and make every effort to attend. Great speakers. Our keynote is amazing. So October 21st, mark that down in your calendars. Any other closing comments from anyone? Well, if not, thanks again for participating, and we hope to do more of these. We know this is a way to share much needed information, so we'll just keep trying to do that, and you will receive that email and some good information. So please reach out to any of us, and we'll try to direct you to the right possible agency person with the right answer. And I will leave you with what I think Norma has emphasized, and that's that we cannot give up. We aren't there yet, and we have families who who need so much more than they are offered. And so that's why we do this with conferencing, support groups, and handbooks and everything, and petitioning our policymakers. So we must continue because we're not there, and our families are depending on us. So help us advocate and be a part of that movement.